I have spent more than 3 decades on ER floors, and I need you to absorb this without distraction. For many people over 60, a first heart attack that strikes when they are alone is often the last. That is not scare tactics, it is reality. Nearly half of all fatal heart attack cases end before a doctor ever lays eyes on the patient. The usual pattern is tragically familiar, precious minutes slip away, while someone second-guesses their symptoms, freezes in fear, or simply does not know the basic actions that keep blood moving until help arrives. Here is the harsh bottom line. Without those steps, the timeline shrinks to minutes. Day after day, I have watched patients rolled into my department who might have survived if they had made one or two different choices at home. They felt crushing pressure in the chest, sudden shortness of breath, lightheadedness, a clammy sweat. And by the time they reached us, the critical window was gone. There is encouraging news. Evidence-based practical techniques exist that you can perform by yourself right now to significantly improve your odds. These are not tricks or folklore. They are straightforward strategies cardiologists teach their own patients. In this video, I will guide you through 7 essential actions every older adult should know to outlast a heart attack when no one else is there. These are exactly the habits I wish every patient had rehearsed beforehand. Pay special attention to number 3. Research indicates it can be the difference between lasting injury and walking out of the hospital alive. Few people know it today. You will by the end. All medical references and studies are listed in the description. Before we begin, tell me your age in the comments. I read and responded as if we were talking in my clinic. Now, let's start with number 7, the first move that can determine whether you survive. 1. Stay as calm and still as possible. When a heart attack begins, the urge to pace, to move around, or to try to walk it off feels natural, but can be dangerous. The top survival principle is simple. Remain as calm and motionless as you can. Every step you take and every abrupt movement forces a weakened heart to pump harder. In the midst of an attack, that heart is already fighting to keep up. By keeping your body quiet and composed, you ease the workload, conserve oxygen, and give yourself the strongest chance of making it until professionals arrive. Here is the physiology in plain language. During an acute coronary event, blood flow through the coronary arteries is blocked or sharply reduced. Any physical effort demands more oxygen from the heart muscle. With supply cut, pushing demand higher only enlarges the injury. Clinical findings reported in the European Heart Journal indicate that limiting exertion during acute episodes lowers complications and improves outcomes. Put simply, older adults who stayed still and kept calm tended to fare better than those who moved about in fear. A 71-year-old farmer in Nebraska discovered this the hard way. While fixing equipment, he felt crushing chest pressure. His first impulse was to climb back up a ladder to reach his phone. Instead, he forced himself to stay put and called for help from where he stood. Paramedics later explained that resisting the climb kept his heart from collapsing under stress. He survived with much less damage than the team initially expected. Calmness is not only a posture, it is a mindset. Panic sends adrenaline surging, raises blood pressure, and worsens the crisis. Focusing on stillness and pairing it with slow, steady breathing blunts that hormonal spike and stabilizes the body. Tell yourself, I called for help. My job now is to stay still and breathe. That self-instruction prevents impulsive choices like walking to the door or stretching for something across the room, actions that can trigger a collapse before help gets to you. Think of the heart during a heart attack as a fragile engine running on fumes. Every bit of motion revs it higher and risks a catastrophic failure. Stillness, composure, and conserving every ounce of energy buy time. This final habit is the most powerful of all. Do less, breathe more, and let the responders reach you. 2. Chew an aspirin if available and not allergic. After you have called emergency services, take the next step that can tilt the outcome in your favor. Chew an aspirin. Do not simply swallow it whole. Aspirin is far more than a pain reliever. It is a potent antiplatelet medicine available over the counter. Because most heart attacks are triggered by a clot, choking off blood flow to part of the heart. Aspirin helps by limiting platelets from clumping, preventing the clot from enlarging and preserving some circulation until professionals take over. The evidence is robust. A landmark analysis in The Lancet showed that giving aspirin during an acute heart attack cut mortality by about 23% in treated patients. Speed is the key. The sooner the drug reaches your bloodstream, the sooner it begins to work. If you swallow a whole tablet, it may take 10 to 12 minutes to disintegrate in the stomach. Chewing breaks it down immediately, allowing rapid absorption across the mouth and stomach, lining within minutes. When every minute means additional heart muscle at risk, those minutes matter. Consider a real-world example. A 70-year-old retired bus driver felt a vice-like pressure across his chest while sitting in his living room. He remembered prior counseling, grabbed an aspirin from the cabinet, chewed it, and dialed 911. Paramedics later explained that this quick action likely maintained just enough flow to spare him from severe damage. He left the hospital 2 weeks later, alive and still independent. Where do people often stumble? They either do not keep aspirin on hand, or they hesitate because they are unsure whether it is safe for them. If you have a known aspirin allergy, a bleeding disorder, a history of serious stomach bleeding, or your clinician has told you not to take aspirin, skip this step. For everyone else, storing uncoated aspirin in an easy-to-reach spot is a smart precaution. Typical advice is one full 325 milligram tablet chewed at the first sign of a suspected heart attack. Think of that single tablet as a rapid response team buying you time until reinforcements arrive. It will not resolve the blockage by itself, but it can slow the cascade that leads to irreversible injury. Acting quickly with aspirin shifts the odds toward survival. And remember, getting through a heart attack alone is not only about medication choices. What you do with your body in those tense minutes also counts. 3. Loosen tight clothing and sit upright. Help reduce strain on the heart. When a heart attack begins, even small choices influence how hard your heart has to work. One of the most effective yet frequently ignored steps is to free the body from tight garments and position yourself upright. Many older adults underestimate how quickly restricted circulation and poor body position can turn a manageable episode into a crisis. Snug belts, waistbands, and collars can compress vessels and hinder the delivery of oxygenated blood at the exact moment your tissues need it most. Sitting upright with your back supported eases pressure on the diaphragm and lungs, so each breath is more efficient, which in turn lightens the load on a heart that is already struggling. This is not only practical wisdom, it is sound physiology. During a heart attack, the heart is fighting to push oxygen through narrowed or blocked coronary arteries. Lying flat increases the effort required, particularly for seniors with reduced lung capacity or conditions like COPD. By choosing an upright posture, ideally at a modest angle with support behind you, you enhance air entry into the lungs, reduce intrathoracic pressure, and promote more effective forward blood flow. Clinical reviews in the European Heart Journal highlight that upright positioning during cardiac distress can help relieve pulmonary congestion, the fluid buildup that makes each inhale feel like suffocation. In plain terms, how you place your body can determine whether you are gasping and panicked or steady enough to last until medical help arrives. Consider the experience of a 74-year-old woman in Florida who noticed chest pressure while gardening. Instead of lying down in fear, she moved to a chair, loosened her apron and waistband, and sat upright while waiting for the ambulance. Her physician later explained that this decision likely prevented a fainting spell and a dangerous collapse before paramedics could provide oxygen. That small adjustment kept her heart from being overwhelmed at a critical moment. It is a simple action many seniors overlook, but it makes a real difference. If those hallmark symptoms appear, pressure in the chest, sudden shortness of breath, or a cold, clammy sweat sits upright, drops your shoulders, and removes anything constricting your chest or waist. Think of it as giving your heart and lungs room to work. This posture buys you precious stability. To push the odds further in your favor, you must also keep blood moving to the brain and heart while circulation is threatened. That sets the stage for tip number 4, a targeted physical maneuver you can perform in the minutes before professionals arrive. 4. Cough strongly if you feel faint. It can keep blood moving to your brain for a short time. The idea may sound odd, but in the midst of a heart attack, repeated forceful coughing can sometimes help you stay conscious long enough for professionals to reach you. Clinicians often refer to this as cough CPR. The mechanism is simple. A deep, powerful cough tightens the chest, and diaphragm boosts pressure inside the thorax and drives blood forward from the heart toward the brain, preserving awareness when circulation is failing. Be clear about its limits. Cough. CPR does not replace urgent medical care, and it does not treat the heart attack itself. What it can do is buy crucial seconds if you feel woozy, lightheaded, or on the verge of passing out before paramedics arrive. Evidence reported in the Journal of the American College of Cardiology found that repeated strong coughing during certain cardiac arrhythmias helped patients maintain blood pressure and consciousness until definitive treatment could begin. In some reports, people remained alert for several minutes by coughing every 2 to 3 seconds. Picture a 69-year-old retired mechanic in Texas who suddenly felt intense dizziness during what proved to be a major heart attack. Alone in his workshop, he remembered hearing about cough CPR, began coughing hard and rhythmically, and stayed awake until emergency crews reached him. Physicians later noted that those coughs likely prevented a collapse and reduced the risk of brain injury while his heart rhythm was stabilized. The physiology is straightforward. Fainting during a heart attack stems from a rapid drop in blood flow to the brain. A forceful cough acts like a manual assist to the heart, briefly mimicking a pump stroke and pushing oxygenated blood forward. It is not a fix and it will not halt the heart attack, but it can sustain perfusion long enough for help to take over. If your vision starts to narrow, your head spins, or your body begins to sag during chest pain, try this. Draw a deep breath, then cough hard, as if clearing your lungs. Repeat every 2 to 3 seconds until the dizziness lessens or responders arrive. Think of it as keeping the circulation moving when the heart is struggling. Once you have stabilized yourself, the next priority is pulling oxygen into the lungs as efficiently as possible. 5. Unlock your door and keep your phone nearby so help can reach you quickly. In a heart attack, the clock is running for you and for the responders. One of the most underestimated survival moves is also the easiest to execute. Unlock the front door and keep your phone within reach. It may seem trivial, but in an emergency, it can determine whether rescuers get to you in time or are stalled outside, while the minutes that protect heart muscle slip away. Barriers cost time, and in cardiac care, time is muscle. Paramedics can breach a door if they must, yet every extra step slows the start of life-saving treatment. Research shows that with each additional 10 minutes before intervention, survival can fall by nearly 10%. Do not lose that advantage to a deadbolt or chain you could have undone in advance. Consider 2 real outcomes. A 73-year-old widower in Arizona dialed 911 when severe chest pressure hit, then collapsed before he could reach the lock. The crew arrived quickly, but precious minutes were spent forcing entry. By the time they reached him, the injury to his heart was extensive. Now, compare that to an 80-year-old woman in Florida who unlatched her door, kept her phone in hand, and waited in a chair near the entry. Responders stepped in, immediately initiated care on the spot, and transported her without delay. She left the hospital with only minor damage. Your phone is the second half of this safety net. Many older adults leave it charging in another room or set it down out of reach. During a heart attack, even a few steps can trigger a collapse. Keeping the phone beside you allows continuous contact with dispatchers who can coach breathing positioning and next actions until the team arrives. Putting the call on the speaker frees your hands and conserves energy while you follow instructions. Treat the phone as your lifeline and the unlocked door as the bridge that brings help to you faster. Together, they strip away obstacles and reclaim critical time you cannot afford to lose. With access secured and communication open, the next priority is keeping your body steady enough to ride out the crisis until professionals take over. 6. Taking slow, deep breaths lowers stress on the heart and oxygenates blood. During a heart attack, panic does real harm. When fear surges, the body flips into fight or flight and releases a rush of stress hormones, such as adrenaline. Heart rate climbs, blood pressure spikes, and the heart that is already starved for oxygen is forced to work even harder. That is why one of the simplest steps you can take is also among the most effective. Breathe slowly and deeply. This practice delivers two essential benefits. It boosts the amount of oxygen reaching your blood and brain at a time when circulation is compromised. And it cues the nervous system to settle, dialing down the hormone surge that adds extra strain to the heart. Evidence supports this approach's research, reported in the Journal of Cardiopulmonary Rehabilitation and Prevention, shows that slow, controlled breathing can lower heart rate and enhance oxygen delivery, even in people with significant cardiovascular disease. It is not a cure for a heart attack, and it does not replace medical treatment, but it improves your odds while you wait for help. Consider the experience of a 76-year-old retired nurse in Michigan. As the heavy pressure in her chest intensified, she chose not to panic. She sat upright, closed her eyes, and focused on a steady pattern of inhaling through her nose and exhaling even more slowly through her mouth. When paramedics arrived, she was fatigued but still alert. Her cardiologist later explained that those calm, measured breaths likely reduced the workload on her heart and maintained oxygen to her brain long enough for treatment to begin. If you ever face this situation alone, use a simple technique. Place one hand on your abdomen rather than your chest. Inhale through your nose and feel your belly rise under your hand. Then exhale gently through pursed lips as though blowing through a straw. Aim for roughly 6 to 8 breaths per minute. Keep the rhythm unhurried and deliberate. This diaphragmatic style of breathing steadies the heart and anchors the mind when fear tries to take over. Think of each slow breath as purchasing a little more time, time for oxygen to reach the brain, time for the heart's workload to ease, time for paramedics to reach you and begin definitive care. And there is one final habit that ties all of these survival steps together. 7. Call emergency services immediately. Do not try to ride it out. The very first and most critical move when warning signs appear is simple. Call emergency services at once. Do not wait. Do not rationalize. Do not tell yourself it is only indigestion and see if it fades. Every minute that passes allows more injury to the heart muscle. Cardiologists have a phrase for this reality. Time is muscle. As long as a coronary artery remains blocked, heart cells die, and your chances of leaving the hospital alive decline. The data are clear. The American Heart Association reports that people who contact emergency services within the first 5 to 10 minutes of symptoms can see survival odds as much as 50% higher than those who delay. Yet many older adults minimize what they feel. Studies show nearly 1/3 of people over 60 postpone getting help for more than 2 hours often because they do not want to bother anyone or believe they can tough it out. That pause can be deadly. Picture this. A 68-year-old grandfather in Ohio noticed an unusual heaviness in his chest one evening. He convinced himself it was likely gas, sipped some water, and sat down to rest. He waited for hours, hoping it would ease. When his daughter finally found him and dialed 911, the window for meaningful intervention had closed. Physicians later told the family that an immediate call could have meant survival with minimal damage. That scenario plays out thousands of times each year, and it does not have to. If you are over 60 and you feel crushing chest pressure, abrupt shortness of breath, unexplained nausea, or a cold, clammy sweat act, as though it is a heart attack until a professional proves otherwise, pick up the phone and call emergency services without hesitation. If it turns out to be indigestion, you have lost nothing. If it is a heart attack, and often it is, you have just made the single most important choice for your life. Recognizing the urgency and making that call is the first act of survival. Here it is. 7 essential actions every older adult should know to survive a heart attack when alone. Call emergency services without delay. Chew an aspirin if it is safe for you. Loosen tight clothing and sit upright. Cough forcefully. If you begin to black out, unlock the door, slow your breathing, and above all, remain calm and still. Each step buys you precious minutes, and those minutes can decide whether you live or die. Keep this in mind. A heart attack rarely offers a second chance. Act quickly, think clearly, and follow the sequence you have learned, and you give yourself a real shot at tomorrow. The evidence is strong, but it only helps if you are prepared to use it. Now tell us where you are watching from and whether you keep Aspirin on hand or have an emergency plan at home. Share your answer below. We read and reply to every comment because your experience matters and your advice could save someone else. Like the video, share it with the people you love, and subscribe for more practical life-saving guidance. Stay safe, stay ready. And remember, that knowledge is power, especially after 60. If you have questions or want to describe your own experience, add it in the comments. We are listening. Thank you for watching.